young women in their
Nearly
20s are
10
developing
million
type 2
diabetes,
diabetes.
including new data from the CDC.
And experts in diabetes
Diabetes
say
is
that
in the early stages of adult.
Diabetes is one of the most common chronic diseases in the United States. According to the CDC, more than 40 million Americans have diabetes, roughly 1 in 8 people. Millions more have prediabetes without knowing it. It's a condition we hear about constantly on social media, sometimes educationally and sometimes jokingly. But what actually is it? Diabetes is a group of diseases that affect how the body regulates blood glucose, or blood sugar. The body either doesn't produce enough insulin, doesn't respond to insulin properly, or both. Insulin is a hormone made by the pancreas that helps regulate blood sugar. When blood sugar becomes too high, it's called hyperglycemia. Possible symptoms include increased thirst, frequent urination, fatigue, blurred vision, and sometimes unexplained weight loss. However, especially with type 2 diabetes and prediabetes, people may have few or no noticeable symptoms. What is life like with diabetes? To understand what living with diabetes can actually look like, let's follow someone through a normal day. This is Tom. Tom has type 1 diabetes. He was diagnosed at 13 and is now 18, attending college. Tom uses a continuous glucose monitor, or CGM, which measures his glucose throughout the day and sends readings to his phone. When he wakes up, almost out of habit, he checks his glucose. It's 4.2 mmol per liter, a healthy level, so he gets up and starts his day. At breakfast, he has toast, cereal, and fruit. Because he has type 1 diabetes, he needs insulin to cover the carbohydrates in his meal. He enters the carbohydrate amount into his insulin pump, which helps calculate or deliver his insulin dose. Throughout the day, his CGM continues sending glucose readings to his phone, so he doesn't need to constantly stop and manually check his blood sugar. Instead, he thinks about the same things any other college student might: his upcoming exam, a party he might attend, and whether he's going to be late to class. During a lecture, he starts feeling tired, so he checks his glucose. It's normal. His tiredness isn't obviously being caused by high or low blood sugar. He's just tired, like any other college student during exam season. At lunch, he has a chicken sandwich, salad, and a drink. Again, he accounts for the carbohydrates and takes the insulin he needs. After his afternoon lectures, Tom goes to the gym. Exercise can lower blood glucose, so Tom keeps an eye on his CGM. After his workout, his blood sugar drops, so he eats a snack. Later, he hangs out with his friends and has dinner, pasta and salmon. Once again, he manages his insulin around the carbohydrates in his meal. Eventually, Tom heads back to his dorm, checks his CGM, and goes to sleep. So yeah, diabetes affects Tom's life. He has to think about insulin, food, exercise, glucose levels, and treatment. But diabetes isn't his entire life. A diagnosis can create extra challenges, but it doesn't define the person who has it. There are several forms of diabetes. The 3 most common are type 1, type 2, and gestational diabetes. Prediabetes is not technically diabetes. Type 2 is by far the most common form, accounting for around 90 to 95% of diagnosed diabetes cases. In type 2 diabetes, the body's cells become resistant to insulin. Over time, the pancreas may also become unable to produce enough insulin to keep blood sugar normal. Risk factors include family history, age, physical inactivity, being overweight or obese, and a history of gestational diabetes. But there is no single cause, and having a risk factor doesn't mean someone will definitely develop diabetes.
You guys, I have prediabetes.
Prediabetes is when blood sugar is higher than normal, but not yet high enough to meet the criteria for diabetes. Think of it as a warning sign, not a guarantee. Not everyone with prediabetes will develop type 2 diabetes, and lifestyle changes can significantly reduce the risk. This is the type Tom has. Type 1 diabetes is an autoimmune disease. The immune system mistakenly attacks the insulin-producing cells in the pancreas. As a result, people with type 1 produce little or no insulin and need insulin every day to survive. Type 1 can develop at any age, although it is often diagnosed in children, teenagers, and young adults. Genetics and environmental factors appear to play a role, but the exact trigger is unknown. Gestational diabetes develops during pregnancy. Pregnancy can make the body cells more resistant to insulin. Usually, the pancreas compensates by producing more insulin, but if it can't produce enough, gestational diabetes can develop. It usually goes away after pregnancy, but having it increases the mother's risk of developing type 2 diabetes later in life. So, what causes diabetes? Diabetes isn't a single disease with a single cause. Different types develop for very different reasons, and several factors can combine to increase someone's risk. Insulin resistance is an important factor in type 2 diabetes. It can be associated with factors including genetics, physical inactivity, excess body weight, certain health conditions, smoking, and some medications. Damage to the pancreas can reduce insulin production. Certain genetic mutations can directly cause some forms of diabetes, while hormonal disorders can interfere with insulin's effects. And then there is type 1 diabetes, where the immune system attacks the insulin-producing cells. So there isn't one set cause of diabetes. So, can diabetes be prevented? Nobody can guarantee that they'll never develop diabetes. There is currently no way to prevent type 1 diabetes in the general population. However, researchers have identified stages that occur before symptoms develop, and a drug called teplizumab can delay progression to symptomatic type 1 diabetes in certain high-risk people. For prediabetes and type 2 diabetes, however, there are ways to reduce risk. Eating a balanced diet, getting regular physical activity, maintaining a healthy weight, getting enough sleep, and not smoking can all help. For people with prediabetes, losing some body weight when appropriate and getting at least 150 minutes of moderate physical activity per week can substantially reduce the risk of developing type 2 diabetes. And importantly, this isn't about finding a magic food or simply eliminating sugar. It's about developing healthy habits. But what if I already have some form of diabetes? Can it be reversed? That depends on the type. Type 1 diabetes cannot currently be reversed or cured. Prediabetes, however, can often be reversed, meaning blood glucose can return to the normal range and progression to type 2 diabetes can be prevented or delayed. Type 2 diabetes is more complicated. You may hear people say that type 2 diabetes can be reversed, but doctors and researchers generally use the term remission. Remission means blood sugar has returned below the diabetes range without glucose-lowering medication for a sustained period. An international expert consensus defines remission as an HbA1c below 6.5% for at least 3 months without glucose-lowering medication. Remission can sometimes be achieved through significant weight loss, changes in diet and physical activity, metabolic surgery, or combinations of these approaches. However, remission is not a permanent cure. It can end, particularly if factors that help produce it change, such as significant weight regain. And not everyone with type 2 diabetes will achieve remission. Genetics, disease progression, medications, and many other factors can influence what happens. Diabetes isn't simply a disease caused by eating too much sugar. It doesn't look the same in every person, and it certainly doesn't define the people who live with it. Some forms can be prevented or delayed, some cannot. Some people can achieve remission, others will need lifelong treatment. Next time you hear someone mention diabetes, hopefully you'll know a little more than you did before.